pulmonary arteries carry the CO2-laden blood into the pulmonary capillaries surrounding the alveoli. The alveoli are tiny terminal air sacs in the lungs, and they constitute a very thin wall of cells between the blood in the capillaries and the air in the alveoli themselves. This thin wall is the ideal location for gas exchange. If we look at Fick's Law of Diffusion, which is discussed in greater detail in other lessons, we see that diffusion across a membrane is affected by 4 factors. First, diffusion is inversely proportional to the thickness of the membrane that the gas is diffusing across. This is why the alveoli and the capillaries have such thin walls. Second, the rate of diffusion is directly proportional to the surface area available for gas exchange. This is why the lungs are divided into about 480 million alveoli with a combined surface area of 50 to 75 square meters. Third, diffusion is directly proportional to the pressure gradient across the membrane. If there is far more gas on one side of the membrane compared to the other, the gas will diffuse across the membrane more easily than if the concentrations were similar. This is essentially why supplemental oxygen is useful. Blood arrives at the lungs rich in CO2 and depleted of oxygen relative to the air in the alveoli, and the concentration gradient drives the concentrations toward equilibrium. The fourth factor is the solubility of the gas, but there isn't really a lot that we can do about that in normal physiological conditions. Intrinsic to everything that we've talked about so far are 2 processes: ventilation and perfusion. In physiology, these processes are given labels V and Q, respectively, and a VQ mismatch is the situation wherein there is too much or too little ventilation or perfusion for the effective exchange of oxygen and CO2 to occur. VQ mismatches can be categorized as either shunts or dead space. A shunt occurs when perfusion is normal, but ventilation is reduced or absent. The common causes of a shunt include pneumonia, pulmonary edema, tissue trauma, atelectasis, mucus plugging, pulmonary arteriovenous fistulas, etc. Dead space is the opposite. Ventilation is adequate, but there is little or no perfusion. Some dead space, called anatomical dead space, is normal. Anatomical dead space refers to the respiratory tract segments that are responsible for conducting air to the alveoli and the respiratory bronchioles, but that do not take part in the process of gas exchange itself. This includes the upper airways, the trachea, the bronchi, and the terminal bronchioles. However, some dead space can occur secondary to pathologies like cardiovascular shock, emphysema, and pulmonary embolism. All of these cause blood flow to the alveoli to be restricted.